In penile cancer, one of the most important predictors for survival are the presence of lymph node metastasis. And in patients who have no palpable lymph nodes, who are clinically N0, often dynamic sentinel node biopsy is performed to see if there are any metastases in the sentinel node. If those are there, then completion inguinal lymph node dissection is performed. However, this completion inguinal lymph node dissection is often negative in almost 80% of the patients and has a high morbidity. So we wanted to see if we're able to predict whether the lymph nodes or whether the inguinal lymph node dissection is actually positive or not. We used we used four different variables to look into this. That's the number of positive lymph nodes, the number of negative lymph nodes, the size of the metastasis inside of the lymph node. This had been shown previously by being Krohn that patients with micrometastasis or smaller than 2 millimeter in a small cohort had no positive inguinal lymph node dissection. And we wanted to test this hypothesis as well to see if it was in a bigger cohort. And we looked at extranodal extension. And all these four factors were actually associated with an increased chance of inguinal lymph node metastasis at completion inguinal lymph node dissection after positive dynamic sentinel node biopsy. And we tested this if we could make a prediction model and see if we could indicate which patients were at low risk of a positive completion inguinal lymph node dissection to see if we might be able to omit this. And this prediction model is actually not strong enough, good enough to see to predict this in a clinically usable fashion. And we looked in a subgroup if the patient with micrometastasis had any inguinal lymph node metastasis, and it was also the case. So we were not able to identify a group of patients in which we could omit the completion inguinal lymph node dissection. So the study still shows that completion inguinal lymph node dissection is negative in 84% of the cases, and that the number of positive lymph nodes, the number of negative lymph nodes, metastasis size, extranodal extension were associated with lymph node metastasis at completion inguinal lymph node dissection. And thus we could see in selected patients who are frail, already older, to discuss if a completion inguinal lymph node dissection could be omitted. But in the complete cohort, we weren't able to create a model in which this was possible.